Every day we take it for granted that someone somewhere is working hard to provide us with the necessary protection it takes to prevent a major health crisis or a bioterrorist event. Here's a look at how some public agencies are using new information technologies to protect our way of life. Detecting or tracking a public health risk before it becomes a crisis is critical to public safety and can save lives. In 2003, an outbreak of SARS created a public health scare that was felt around the world. As a result of that epidemic, events like the anthrax attack of 2001, many government agencies, healthcare agencies, and first responders have sought out new ways to detect, warn, and possibly prevent public health emergencies. To answer this challenge, information systems now allow public health officials to sort through raw data and spot trends that may indicate the beginning of a public health or bioterrorist event. These systems can also help officials detect where a disease or bioterror outbreak began, so that the threat can be traced from its point of origin and allow officials to track its progress, treat those affected, and prevent it from spreading further. One company, Scientific Technologies Corporation, has taken the initiative to partner with public health agencies to implement a syndromic surveillance system called Early Alert that offers a proactive approach to fighting public health or bioterror threats. Already, several states have begun to provide better protection for the public by implementing these systems.
The state of New Hampshire is working very hard on emergency preparedness right now, and particularly in regard to responding to bioterrorism. We're very interested in detecting trends and outbreaks as early as possible, because if we can do that, we can prevent illness and prevent the situation from becoming larger. So these information technology tools really help us detect trends earlier and detect outbreaks earlier, so we can respond earlier and prevent it from escalating.
As most recently demonstrated with the avian influenza, disease has no boundaries. Early detection, early warning, and overall preparedness are the keys to minimizing the impact in human, social, and economic costs of disease.
When a cold or flu is spreading in a community, long before people go to the doctor or to the emergency room, they go to the drugstore to get tissues or orange juice or over-the-counter cold remedy. The Scientific Technologies software gathers all that data for the entire community and analyzes it and presents it to the health department. The health department can see extremely early if there's an outbreak spreading in the community, and they can see the speed and the severity of that outbreak and decide whether or not they need to make an intervention.
The ability to provide better homeland security through information management is just one of the many ways in which new technologies are helping us to preserve our freedom and the American way of life.